Well, hello, 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 my unconventional agents of change. I hope that you are excited, as I am, for our last session in the 6 session series, How to Build a Multi Six-Figure Public Health Consulting Business. My name is Quisha Umemba. I am the public healthpreneur. I teach helping professionals like yourself how to leverage your expertise and education, how to package your genius, and how to monetize your skill set to make impact and income by starting, growing, or scaling a profitable public health consulting business. Welcome if this is your first time joining me for this 6-part series, and welcome back if you have been along for the ride this entire time. I cannot believe we've gotten to the last session, but it's here already. So we have had some really good conversations over the last several sessions, and I wanted to recap those for you who have not been along for the journey. So you make sure you go and watch those if the topic interests you. Over the last 6 weeks, I have wanted you to really put yourself in the best position this year to be a profitable public health consultant. And so I decided to offer this training for those of you that had so many questions, really just curious about how to not only make 6 figures, but multi 6 figures. One thing I will always say is I discovered the secret sauce. And once I discovered that secret sauce, I saw how it impacted my bottom line and ultimately the impact that I have in individuals, organizations, and communities. Sorry, I lost my train of thought there. So let me just recap really quickly the different topics I've talked about over the last 6 sessions, and then we'll get into the content for tonight. Part one, or session one, I talked about perspective. That is the mindset that you need to be a successful public health consultant, or really to be an entrepreneur in general. And so that session really focused on mastering your mindset. Session two was all about positioning, marketing your expertise, positioning yourself and your business to really stand out in the market to your potential clients and customers. Part three, or session three, I talked about pricing. This is what most consultants and entrepreneurs have the most questions about. And so I talked about how to monetize your skill set. I highly recommend all of the sessions in the series, but I really think that one has the most value. Part four's series was all about packaging, how to maximize your brand. We talked about logos and messaging and brand equity and all of those things to basically make your competition irrelevant so your business stands out. You put the best foot forward in your industry. Our last session, we talked about processes, specifically how to minimize and optimize your processes. And I mentioned saying that that really is the secret to 6-figure success. And I can really remember the minute I got my systems and processes and workflows in order, it really directly impacted my bottom line in a positive way. And so I talked about how important it is for you to incorporate automation into your business, how important it is for you to incorporate delegation into your business. What else did we talk about? Elimination. And then we also talked about workflows as well. That's also a pretty valuable session. So like I said, they're all valuable. So go back and watch them. Now, tonight's session, we're talking about pitching, how to make money as a public health consultant and entrepreneur, because a lot of you all want to be successful in business, but you have a hard time selling yourself and selling your services. So let's get into tonight's conversation. I'm probably going to be talking quite a bit. I do hope I can wrap this up in 45 minutes. Certainly not more than an hour, but I've got my water here just in case. So let me get a sip before we get started. Okay. And also, I just want to check one thing with my sound. I noticed this issue last time, so let me just, okay, get around my camera there. All right, great. I'll pull my notes back up. All right, so let's talk about this. This is something that a lot of newbies have issues with. I had issues with. It's to be expected, and that is selling yourself, selling your services. Trust me, I get it. Selling your services trying to convince others to buy what you have to offer, to buy your solutions. It feels so totally uncomfortable and unnatural in the beginning. If you're a nurse, which I am, they don't teach you that in school. If you're a public health professional, social worker, medical, whatever it is, they don't teach you those things, right? It's not a business degree, it's not a marketing degree. So it feels unnatural, at least in the beginning anyway. And let me tell you what public health professionals and helping professionals in general really struggle with. We really struggle with charging for things that we've given away for free for so long. We really struggle with charging for things that we can do in the blink of an eye. We've done it so long. What takes someone 8 hours to do might only take you 1 hour to do. And so you feel, oh, I'm not going to charge for that. Or if I charge for it, well, it only took me 15 minutes to do. It's no big deal. It is a very, very big deal. So, my friend, I want to tell you, if you are in business, your business is to make money. Okay, let me say that again. If you're in business, you're in a business to make money. Even if you are in a nonprofit organization, if you are not making money, your business is not sustainable. If you are not charging for your services or getting grants or some kind of way to generate revenue, you cannot make an impact. You cannot serve. You don't have the resources, the time, the capacity, the supplies, the equipment, any of that to make a dent in any kind of intervention or initiative that you're partaking in or you're participating in. So if you are not making money, guess what? You're not in business. What you have is a hobby, a timely hobby that's going to get you nowhere fast, right? So one of the things that really helped me in forming or reframing my thought process around selling was to change out that word. I don't look at what I'm doing as selling. I look at what I'm doing as serving. I have solutions for individuals like yourself or for organizations, and those are my services that I offer to help you get from point A to point B or to address a certain pain point. And when you look at it as I'm serving you with this product, with this training, with this report, with this research, whatever it may be, then you feel more confident and comfortable in pitching that service. Now, I also want to mention this about selling too, and I'm completely going off notes here because I just thought about this in one of the leadership development classes that we do with my public health consultancy. When I'm trying to tell people in our communication and influential relationship workshops, everything you do in life or in your profession involves selling. It may not sound like it, but it is selling. It's persuasion. Let me give you some examples. If you've got a teenager and your teenager wants to come home they want to come in from a party, let me put this on silent, um, at midnight, and you're saying no, the curfew's at 10, and you're going back and forth and coming up with a compromise, that you're using the gift of persuasion. That is selling them. If you're caring for an aging relative or parent and you are trying to get them to take medication and they don't want to, or even not even an aging parent, if you're trying to give medication to a toddler and they don't want to, you're trying to convince them to do that. That's the gift of persuasion, right? Everything that we do, we're selling. If you're trying to hire somebody to come work in your organization, you're selling them on your organization and the reason and the benefits that come with working for your employer. That's all selling. And so when you really think about, oh, everything that I do is kind of selling in some aspects, because I am compromising, I'm being persuasive, I'm troubleshooting, I'm problem solving. All of that is selling. And that's how you have to reframe your mind. Secondly, you have to get okay with being told no. You have to be okay with being rejected, with being denied, with your services being passed over and looked over, because it's going to help build that thick skin that you need. And it'll get to the point, I'm at the point now where, one, I've noticed that a lot of times when I'm passed over in business, they end up circling back and coming back to me anyway. So I know that will happen more times, 50% of the time. But I also am at the point now when I am pitching my services to an organization, I know that my services are so good. I want them to take me up on the offer. I want to serve them with my training. I want to serve them with my curriculums. I want to serve them with technical assistance because I know I have a solution to their pain point. And if they don't take me up on it, how unfortunate for them. I really could have helped them. I really could have made, whatever the issue was, I really could have, made their vision come to fruition. That's the way that I look at it now, and it has made all the difference. Okay, so now let's talk about some ways that you, as a consultant, can pitch your services. Okay, first of all, you got to sell your solutions. That's point blank, period. You have to sell your solution. So on any given day, I am scheduling discovery calls, or conducting rather discovery calls. I give sales presentations. I am nurturing my business leads. I'm doing a number of things following up on potential business, because the fortune is in the follow-up. I don't know if you've heard that, but it's true. The fortune is in the follow-up. As a matter of fact, let me give you an example. My nonprofit organization, we don't always do the best at checking our email. And we got an email probably in November. That's National Diabetes Month. We got an email in November from an organization out of Florida that wanted to book my services to speak during National Diabetes Month for a diabetes related conference. Well, we didn't see the email until the 1st of January. They sent this on like October 18th for November, and we didn't see it until January. And I said, well, it's not going to hurt to reach out anyway, right? The fortune is in the follow-up. So I reached out. I booked a phone conversation with the event planner. We had a conversation the next day for like 90 minutes. And long story short, I'm flying out in a few months to go speak at another diabetes conference that they have, in front of healthcare professionals, right? If I would have just said, oh, that opportunity has passed, we're past National Diabetes Month, it's no sense of reaching out, I wouldn't have had this opportunity. You have to follow up. So ways that you can pitch: you can send emails, right? If you don't have an email newsletter, I talked about this, was it last session? I think it was the 4th session, right? When we were talking about branding. If you don't have emails, you need to incorporate a way to collect emails. So you can send pitches in emails. You can send pitches in LinkedIn messages. I have actually purchased services from someone that pitched me, which I hate, in a LinkedIn message, but I actually needed the service at the time. It was perfect timing. I ended up spending $3,000 on a package for publicity. It was a publicity and like media package thing, and it was perfect timing. And he pitched me initially in a LinkedIn message. You can also do phone call pitching, right? You can do cold calling, where you don't know the organization, you don't know the individual, you just call the number and pitch your services there. I personally prefer a warm outreach, either a referral. Maybe we met at a networking event, we met at a conference, something like that. But you can do phone call. You can do other social media platforms as well. In-person pitching works also. So networking events, conferences, like I just mentioned, and the coveted proposal. Okay, so when we talk about proposals, as far as pitching goes, there's a couple of different types. There is the RFP, request for proposals. I'll talk about that in a little bit when I talk about government contracts. But there's just the regular old business proposal. And so a business proposal, in short, it's basically just how you and how your business shows up on paper. Now, I can't brag about this right now. There was a time when I was closing 75%, 3 out of 4 of any of my contracts that went to the proposal stage. So, you have an initial conversation, you have a discovery session, and then they ask you to submit a proposal. I was closing 3 out of 4. That's freaking good for a while. It's not always that good, but there is an art to developing a good proposal. I'm not going to go into it here. That's something that I teach in my Ready.Start.Launch program. But just know that you can pitch your services. You need to be pitching yourself, selling yourself in your proposal. It normally comes after the initial discovery session. And when you put your proposal together, you want to have things like, your organizational background, your scope of work, the timeline, the deliverables, the consulting fees, and whatever else that they ask you, that they may require for you to put inside of that proposal as well. Now, government contracts, okay? Most of you all, especially if you have been kind of doing your research, or maybe you're already consulting, about government contracts. Now, I personally love government contracts because the right government contract can carry your business for months. As a matter of fact, I got a six-figure contract, over six-figure contract last year, and it seriously carried my business for a very, very long time. So that's always the ultimate goal in public health consulting, is to get one of those, especially if it's one of those where it's pretty cushy. You're not working as many hours, you're not having to put too much brain power in, and you're getting a really nice return on your investment of time for the time that you're working on that project. I think that's the best way to say that. Now, government contracts are not always easy to get. It took me about 18 months of consistently writing RFPs before I got landed my first contract. And so there are some things you can consider. It can take a very long time in the beginning for you to write or respond to an RFP, okay? A lot of times when you are responding to an RFP, there are dozens, if not hundreds of organizations that are also responding to the same RFP. A lot of times they're huge organizations, right? And your little small solopreneur business or, small team is just not going to compete. That's why it's always best if you can partner and collaborate with another organization that may have additional resources and capacity, et cetera. Don't give up hope. Don't lose faith. It is a business model that you can consider. It is not a business model that I would bank everything in my business on. I would not tell you to have a business that is just based on RFPs, or just based on grants, or just based on referrals, or just based on word of mouth. You should have a diversified portfolio. So, and I'll talk about that here in just a minute. So before I go into different revenue streams and ways you should be pitching and selling your services, I'll just give you a few examples, because a lot of times, especially if you're new to the field, you really don't know what kind of government contracts you can get. I have had contracts for training and technical assistance, curriculum development, curriculum audit, resource development. So creating resources to go inside of a toolkit, health promotion, program planning, implementation. I have colleagues that get contracts for community health assessments. You may get surveillance, data analysis, or like creating data dashboards, policy analysis, emergency response. I mean, the list goes on and on. As varied as the field of public health is, and the different tracks and the different specialties and disciplines, there's a contract for that. Like, seriously, it's so many different opportunities. And this is what you should really consider. Don't go after everything. If you are a health equity strategist or health equity consultant, go after health equity projects, okay? If you're a trainer, facilitator, go after those type of projects. Don't just apply to apply, because it can be very time consuming, reading through it, completing all of responding to it, completing all of the additional documents they're asking you to put together, the work samples, all of the other things can take a lot of time. And it's a high likelihood that you may get a no. So that's all I'll say about government contracts, but they are life-changing if you get one. So I'm not saying don't do it. I am saying be very strategic in the ones that you go for. As a matter of fact, we've just implemented that in my business. We don't go for as many. We actually have some criteria that we've developed that will specify whether we'll put our time and energy after going for a specific RFP opportunity. So now I want to talk about multiple streams of revenue. Multiple streams of revenue. I have found that most public health consultants do not have multiple streams of revenue outside of the general consulting or TA that they provide. I will be honest, this is what has allowed me to build a multi-six-figure public health consulting business. And that's having multiple streams of income. So what I mean is our general complementary service are training, technical assistance, curriculum development, right? However, in addition to that, we also are a continuing education provider. So we generate revenue by selling CE courses. We generate revenue by licensing our training curriculum to organizations. We generate revenue from speaking engagements. That's what I mean by having multiple streams of revenue. We also have products, right? We have toolkits that you could purchase, like the Start Your CHW Training Academy. There's other things as well. And so having multiple streams of income is crucial for any business, but certainly crucial for you as a public health consultant that wants to be sustainable. So we're talking about financial stability. You don't have to rely solely on one single source of income. We're talking about diversification, right? So not having to depend on that one single client or that one revenue source. Of course, increased revenue is probably the biggest reason that you want to do it. Well, second biggest reason. The first biggest reason that you want to have diversified revenue streams is sustainability. I said it earlier, if you are not making money, you are not in business. You do not have a business. And if you're not making money, you can't make impact. And if you want to make impact in the field of public health, you have to be sustainable. For me, there are times where we have 7 or 8 contracts at one time, and we're making good money, and I've brought on extra subcontractors, and we're just knocking it out. And then there's times when all of those contracts, maybe except 1, 2, or 3, will end at one time, and I'm like, oh, I need some more revenue because I've got more people on my team. I've got projects that we've got. So I'll say, you know what, we're gonna have some extra workshops. We're gonna go hard on pitching our curriculum to organizations. We're gonna make more offers on other things that we provide. That's why it's important for you to be able to have multiple streams of revenue so that you can be sustainable in your business and ultimately be more impactful. All right. Lots of information. If you're taking notes, I know you're probably writing at 100 miles per hour. I'm going to take a sip of water, and then we're going to go into the last part of this conversation where we talk about the art of pitching your services. Okay. Now, there is an art when it comes to pitching your services, and the first thing you need to do is be confident. You need to be confident and own who you are, what you know, what you do. So basically how you serve and the outcomes that you can bring the individual organization that you're working with. People can see confidence or lack of confidence very easily. So first, be confident in that. Work on reframing that mindset to where you want to serve them so bad, you hope they take you up on the offer, not that you're trying to sell them on something. If the idea of selling them on a service or a solution makes you feel uncomfortable. The second thing that you want to do is you want to make sure that you build a trust and rapport with the individual that you're pitching, right? I talked about this in another session where you have to build this no trust factor before anybody will buy into what you're selling and what you're talking about. The purpose for me doing this 6-session series was for me to build this no trust factor with you as well. It works very much the same way. So don't go, and I think for me, that's why I don't like cold pitching. Not to say it didn't work. Remember, somebody slid in my LinkedIn DM and I ended up paying them $3,000 for a service, right? It does work, but it works. The statistics are higher if you go in with someone that you have taken the time to get to know a little bit. They understand what you're selling, and then they trust you. Then you want to listen to understand their needs. What is their specific situation? What are they trying to accomplish? What are their pain points? Just listen. And after you have identified those pain points, then you want to share with them the areas where your expertise could benefit them the most. And this is where having that crafting, compelling elevator pitch comes in, or we also call it a unique selling proposition or a unique value proposition. And if you don't have that, you need to go back to session number 2 where we talked about creating that. Again, that's who you are, what you do, how you serve, and why you serve, okay? Making sure to also incorporate in your pitch the outcomes and the benefits that you can deliver on said project or initiative. Now, when it comes to pitching, you also want to make sure that you tailor your approach. That's one of the things, it's a pro and a con. So most of the times, the projects that you're going to be working on as a public health consultant and entrepreneur are customized, tailored solutions. It's great because it really helps us meet the organization or the community or the individual where they are, but it also can be timely and costly for them as well. In some industries, they don't want a customized solution. They want something that's called commercial off the shelf. As a matter of fact, if you work with the federal government or you're looking for federal contracting opportunities, you'll see that quite a bit. Commercial off the shelf. They mean they want a curriculum or they want a toolkit or they want a product that's already been in the works, that's already been tested and validated, that they don't have time to wait on it to be, we want to do the needs assessment and we want to do the environmental scan and we want to do the focus groups and all of that stuff to inform what we're creating. But that's not always the case with some industries, okay? In public health, most of the time, it is going to be a tailored approach. So you're going to make sure that your pitch also is tailored and customized to those unique needs and concerns that they're sharing with you, not a one-size-fits approach. I can't say this enough. Highlight your expertise. A lot of us helping professionals don't like to brag on ourselves. Brag on yourself. If you have worked with clients before, or even things that you've done in your 9 to 5 that were beneficial, that showed really good outcomes, whether you're saving money off the bottom line, whether you're making money, right? Whatever it is, I can't think of any specific examples off the top of my head right now, but whatever it is, make sure that you're emphasizing on those things. If you have relevant testimonials or relevant case studies to share with them, reviews from past clients that demonstrate that work as well, make sure in your pitch you share that information also. Social proof is so important, so very important. Think about you. Think about what we do. The first thing we do is go to somebody's website, see what somebody else's experience has been working with them. So make sure that you include some social proof in that as well. Be sure, again, as you're listening, you address any concerns and objectives that they may have as well. And most importantly, provide a clear call to action. Now, all of the steps that I've given you, that can be a written pitch, that can be a spoken pitch, or you can include all of those things in a written proposal. Most of the time, I'm giving those things in a written proposal. Give a clear call to action. As a matter of fact, all of my proposals have 4 steps that we take, and it starts out saying, these are the next steps. Accept the proposal as is. And, then we'll go to contract execution. If you have questions, I think is number 3. If you have questions, schedule some time for us to meet and negotiate terms. And then 4, the work begins. Pay sign the contract. Once the contract is executed, payment is made and the work begins. So make sure they understand what those next steps are. Now, this is equally important when it comes to pitching. Most of the time, you're going to get a no, especially in the beginning. That's completely fine. Don't lose them to follow up. Follow up and stay engaged after that initial pitch. Just because someone tells you no today does not mean no next month, or no in 6 months, or no in the next year. I am speaking from experience. And so what I encourage you to do is what's called a nurture campaign. If you have a CRM, set them up in your CRM on a nurture campaign. If you have, just an Excel spreadsheet or a Google Doc, make sure you have some system in place that says, hey, I pitched these individuals 3 months ago. They weren't interested at the time. I'm going to reach out to them in 3 months or 6 months just to see how they're doing, right? Just to say, hi, it's been a while since you reached out or since we connected last time, just letting you know that we're still here doing XYZ if your needs change, right? It can be something short. It can be something long and extensive. I actually just did this a couple of weeks ago. I sent an email out, Happy New Year, just letting you know we appreciate the work we've done with you in the past and the opportunity to do business with you in the future. For 2024, these are the areas of focus that we're providing. Do you have any training needs that we can explore together? I can't remember the whole letter, but that letter was forwarded. Someone that was a previous client forwarded to someone else and said, "Hey, I got your information from so and so. I like these trainings that you're talking about. We actually just identified our training needs, and we actually need someone to train on leadership development. Could we set up a time to explore what this looks like?" So you have to follow up. You have to stay engaged, and it's not a one-time thing, right? It's a stay engaged forever, unless they literally tell you, like, "Look, take me off your list. I'm not interested. I don't want to buy what you're selling. We have no use for it." Stay engaged with those individuals, because I have worked, and I say work on clients. I have engaged clients, both organizations and individuals, for 2 years before I've gotten one sale with them. So it does take time. Stay the course. Whew, I've shared a lot of information with you, but I think you get the gist. And I do actually want to wrap up now before I overload you with too much information. So let me do a quick summary of what I've talked about in this video. So I talked about selling your services or pitching your services and the importance of pitching. We even talked about how you need to reframe your mindset to get comfortable with the ideal of selling. I also talked about the different ways that you pitch your services as a public health consultant or entrepreneur. We talked about general pitching and the various methods. We talked about proposals. We talked about government contracts like RFPs or even grants. Those are different ways. And then I also share with you multiple revenue streams, which I highly recommend. Not initially, not initially. Initially, get good with doing one thing, have one package, one service. But as you grow and scale, then adding on those different revenue options. And last, we talked about the art of pitching, some things that you need to consider, some things that you need to make sure that you include in your spoken and your written pitches or in your proposals. I hope that you found the information in this last session helpful. I want to provide a recap one more time of the 6th series session. Part 1, perspective or mastering your mindset. Part 2, positioning or marketing your expertise. Part 3, pricing, monetizing your skill set. Part 4, packaging, maximizing your brand. Part 5, processes, minimizing and optimizing your processes. And Part 6, pitching or making money. This 6-step process is my secret sauce called Ready.Start.Launch that I teach inside of PublicHealthPreneur Academy, my membership. If you're interested in joining, go to my website, QuishaUmemba.com, for more information. Sign up for the waiting list because the membership is opening in less than 4 weeks. I want to give you a few more things that I think might help you as you get started in starting, growing, or scaling your public health consulting business. One, I have a free resource on my website. It's 40 plus pages and a checklist on how to get started. It's called the Public Health Consultant Starter Kit. Again, it's completely free. Visit QuishaUmemba.com to download it. I'm also hosting a webinar on February the 7th. It's titled Possibilities in Public Health Consulting: How to Go from Public Health Expert to Public Health Entrepreneur. You don't want to miss it. Again, another completely free resource for you to hear firsthand how public health consulting has benefited my life and allowed me to not only live out my purpose, but make profit, really good profit, doing so. Now, if you're not following me on all social media platforms, shame on you. You should be. You can find me at Quisha Umemba on all platforms or at Public Healthpreneur. And please, if you're ready to get started now and you know you were meant for more, don't wait, don't delay. Schedule a discovery session with me so I can help you start, grow, or scale a successful public health consulting business that makes impact and income. It's been a pleasure over the last 6 series, and I hope to see you in the next video very soon. Take care.